Hi, I'm Dr. Seema Sharma and I'm founder director of Srishti Femcare. Here we specialize in dealing with the post-delivery complications, in the breast or otherwise. And by means of today's video, I want to talk about the breast pain and mastitis that a lot of women undergo because they don't know how to breastfeed properly. So first thing is, I want to talk about why does this happen. Uh, all women have, if you look at the breast, at your breast, it has a nipple and it has an areola around it. That's the dark patch. When your baby does not latch properly, it just puts in the nipple in the mouth. That's the time, you would find a sharp stinging pain when the baby starts to suck. Because nipple is very sensitive. It has a lot of nerve endings. Now, the idea is when you start breastfeeding, you must allow the baby to put the whole areola in the mouth. You might have to help and thrust the areola inside for the first few times for the baby to understand what is expected. Second thing, why the pain happens is because the breasts have become too full of milk. In the initial few days, the baby's stomach capacity is very small. It is just like 30-35 ml, depending on the size of the baby, even smaller. So that means at one go, the baby cannot take too much milk. Now, after the first 48 to 72 hours, once the good milk stops, the colostrum finishes, suddenly you would see a copious amount of milk coming into your breast. Now, that means that, there is too much of supply and the baby cannot consume. That means that all that milk stays behind in your breast. Now, you need to empty your breast of all that milk. It seems cruel, but then yes, if the body is producing extra, you just remove it from your breast and either store it in the fridge, discard it, whatever, feed the baby later on, that's fine. But you must keep your breast empty. Another thing I would want to recommend here is that a lot of women wear very tight bras, thinking that their breast size would shrink better and they would get shapely faster. But please use this as a word of caution that you must use appropriate size clothing. If you wear very tight undergarments, you will feel when the breasts get full, you will feel the pain faster. Another thing is when you use breast pads to keep dry, because there's a certain amount of milk which might just leak without any notification. It just comes and it spoils your clothing. So a lot of women put a breast pad between their skin and their bra, which is okay, but just make sure that you are removing these pads occasionally, and by occasionally I mean every 4 to 6 hours, and put the new ones, because you would not, they're essentially sponge, and they will absorb the extra milk. That's fine. That will not spoil your clothes and you will not have a social embarrassment. But once your skin remains wet for a long time, you might have a mastitis faster. So a few simple things, wearing appropriate clothing, keeping yourself dry, and keeping your breasts empty by either massages or feeding the baby very frequently. These are a few things that you can use to prevent your breast from developing mastitis. Now, another question a lot of people ask me, doctor, should we use hot fermentation or should we use a cold fermentation? Somebody says use cold, somebody says use hot. What do I do? So the answer to that question is, what are you looking at determines what kind of heat temperature you should use. If you have breast pain and you want to relieve yourself of the pain, then hot fermentation works. You can have a hot bath, you can have a hot towel, anything. But if your breast is red, you are sore, your breast is very heavy, you want to relieve yourself of the heaviness and the redness, then you need to use a cold compress, because cool compresses will reduce the inflammation. Already, if you have developed a mastitis, cold compresses are what are required. Before the mastitis sets in, maybe hot fermentation will work. Right? So when your breasts are by and large red, please do not use anything hot on the breast. And be kind to your body. A lot of, when we say keep your breast empty, a lot of women will just kind of keep pinching their breasts and, they're trying to remove the milk. But what you should do is, you must use the flat of your fingers and from the outside, to the inside, you keep gentle massages, and once the milk has been directed towards the nipple, use both the hands and use the breast tissue between your hands to gently compress in all directions, like that. And that's how you will gently squeeze and release out all the milk. Another option is to use a breast pump to remove the extra milk that you have. But despite sometimes all the precautions, women do develop breast abscess, which is like one of the dreaded complications after childbirth. We don't want to go through that direction because it is mighty uncomfortable. Once a surgeon gives a small incision, removes the pus, the incision takes a long time to heal, and you need antibiotics, and you're away from the baby, you are in pain, you've already endured all that pain in delivery, and then again now, so a lot of women go into depression because of that. So sometimes, but sometimes despite the best things, you do develop a breast abscess. So if you have fever, you don't feel well, you have chills, your breast is red, or you see visible pus on your nipple or anywhere else, there is a point on the breast which is painful and there is a pus point, please visit your doctor quickly, because sometimes if you catch it very early, a good antibiotic cover will heal it. Don't allow it to go to a point where you need surgical evacuation. So my advice is, keep track of your breasts, keep them dry, keep them empty, look after them, look after the skin, and also look at the baby's mouth hygiene. Sometimes there is a fungus on the baby's tongue which can give you a fungus as well. So these are all the things that you need to look at, and despite all that, should this happen, please visit a doctor early. That's all for today. Thank you so much.